Hi, this is Dr. Tom Rogers at Performance Medicine, coming to you with a weekly podcast of the Common Sense MD. Today I'm going to talk about your butt. Now that sounds kind of funny, but this is kind of a serious topic. But we're going to talk about your butt, specifically the gluteus maximus and the gluteus medius. Now there is a gluteus minimus, which is also important, but the first two are the most important ones. You train the minimus by training the other two. But it turns out that your butt's very important, and for many reasons, but the main one is it keeps you from dying if you have a strong butt muscle. As you get older, a lot of people, if you notice, their butt muscle kind of shrinks a little bit and they become very unstable. Then they start developing a lot of knee and hip problems. But one reason why I try to do squats in some form every day is one of my exercises. Now, I'm just talking about air squats mostly. Sometimes I use a little bit of weight, but mostly air squats. So that may be the most key important exercise that I do is a squat. Just place your feet about shoulder width, just go down as far as you can, almost to where your butt is touching close to the floor if you can get it. Now that requires some flexibility, but you need to kind of look and see what kind of butt muscle you have. Is it getting flat? Is it strong? Because to me, that's one of your main core muscles that you need to stabilize your trunk. When we think about your core muscles, a lot of people just think about the rectus abdominis and the obliques and the transverse abdominis, and maybe the multifidus. But also, think about your gluteus maximus and gluteus minimus and medius. So there's three of them. But the glute max is the primary hip extensor, and it's the muscle that we forget to strengthen the most. It stabilizes your hip and pelvis and helps us to go from a seated position to a standing position. Very important as you get older. And if you see people, you can almost watch them, and if they have to use their arms and they have struggle getting out of a chair, they've got a weak butt muscle group, and they need help. They need to train this. You can get it strong pretty quickly. And I'll talk about some exercises for it in a minute. But what it does, it helps us go from a sitting to a standing position, helps us climb stairs, helps us keep an upright trunk posture, and it's really an antagonist muscle to the hip flexors, which are usually tight due to a lot of sitting. Remember, sitting is the new smoking. You need to move around and strengthen this. The glute medius also weakens as you age. You don't see this one so much, but there's some specific tests you can do. I know when Ernie is testing people, including me, when you find out you start having some hip and knee problems, he'll go to your glute medius and find out that's usually very weak. So you have to strengthen this if you want to preserve your hips and your knees for sure. The glute medius is the chief hip abductor, meaning go out, which stabilizes the hips and pelvis during ambulation and also standing. Weakness there contributes excessive wear and tear on both the hip and the knees. The cartilage can wear out faster because of weakness in that glute medius. So it's very important. How many people do you know that my age especially and a lot younger that have had knee and hip replacements? Many of my friends have had this done. So when you think about your core muscles, think about your butt muscle. You need to strengthen all your core muscles, just like the ones in the front as well. A lot of people work on their front muscles but ignore their back muscles, which includes your butt muscles, and it leads to a lot of instability, which leads to excess falls as you get older and very high mortality rates after falls, especially if you fracture your hip. One thing you can do to really test, one thing I like to do on my patients is, if I'm worried about them, I'll watch them go from sitting to standing without using their arms. And also, I have what I call the 10-second test, which I tell them to stand up, stand on one leg looking forward, and if they can stand on one leg and maintain that one-legged balance for 10 seconds or more, they're usually pretty good. But if they can't maintain standing on one leg for 10 seconds, then their mortality rate for the next 5 years is pretty high. So do the one-legged test on yourself. Just stand on one leg, look straight ahead, and put the other leg, maybe behind your knee, or on, if you do yoga, you can do one of those poses. But try that for 10 seconds and see how you do. If you don't do well on it, you better start working on your core. Now, core exercises, of course, the squat is the most important one for your butt muscles. Also hits a lot of other things as well. But other exercises you can do for your core are the bridge is one of the most important ones that we do. And you can use planks. I like the side plank. I like the front plank. One-legged knee raises are really good. And if you really want to look at these, we'll try to demo some of them, or come see Ernie Dixon up at our office in Kingsport. He's amazing with helping you with stability and balance, and that turns out to be very, very important as you get older, because if you fall, you may be healthy otherwise without heart disease or cancer, but if you start falling, you're going to die within 5 years or so, maybe sooner, maybe within a year or so. You have to look at your mobility. Plus, it reduces a lot of pain too. As you get older, you get stiffer, and you sit around too much. You don't stretch enough. You don't drink enough water. So if you want to age well, you certainly think about your core, and especially your butt muscles. I'm not talking about looking good in a bikini. I'm talking about aging well and being able to walk upstairs and hike and ride bikes and all. So I hope this helps you. If you have problems with this, come talk to us at Performance Medicine. I'll see you next week. Hi, this is Dr. Tom Rogers at Performance Medicine. I'm a little short of breath, but Ben came by and I wanted to show you my gym that I have in my basement that is really all I need for my workouts. So I'm kind of right in the middle of it, but I'll show you kind of what I focus my workouts on as a 67-year-old man who's trying to just stay limber, fit, lean, energetic. First of all, I do a lot of band work, especially this, because I've had shoulder problems, I've had back problems, and a lot of it's just band work. I don't lift heavy weights anymore. And this right here is something that I work my back muscles on. Just that little movement helps me a whole lot. Hold 6, and then you hold for 6. Really, a lot of what we do is focused on building the back up, not the front. I'm interested in the back part of my body because that's what holds you erect, makes everything strong. You don't want to sloop over like an old man. So come on in. Here's a bunch of my other bands in here, and I do a lot of work with these bands. Of course, work these out, work my triceps out, and I work my shoulders out. I'm just going to show you some form that I do so we can kind of show you the various things that I do. I also love these things, these TRX type workouts, where I work my triceps out with them. I go really slow. Great tricep workout. And then you kind of loosen up with your chest like that. Slowly, slow, hold. And as you can tell, I have 2 pull-up bars in here. So I do a lot of pull-ups. When I do a pull-up, I try to emphasize the back and pulling the bar towards my chest, not straight up. So, and I try to go slow. And I hold it. While pulling my scapula back together. And of course, I do a lot of push-ups. I use these perfect push-up handles. I can get deeper. And I keep my elbows in tight, like that. They go really slow. Really slow. I hold, because I'm really not interested in how many I'm doing anymore. I'm interested in form. I love my squats. The most important exercise you'll ever do is a squat. I don't use heavy squats anymore. I use this little 20-pound bar, and I go slow. Like that. I also do a lot of lunges, but this is something that I love. Kettlebell. I love the kettlebell. And of course, I have my bench, where I have my hand weights, where I do chest presses, curls, that type of thing. So I use my bench a lot. There's for my back. I get on this board every day, teeter board. I hang upside down. There's my rowing machine for cardio. And here's my infrared sauna. Love it. Love my infrared sauna. There's my back machine, where to make my core strong, especially my lumbosacral muscles, I'll low down slowly, grab the ball, never go past 90 degrees. Slow and hold. That really strengthens my core a whole lot with all the core exercises. And when I get out of my infrared sauna, I'll go right in there and take my cold shower. So that's a typical workout morning for me. Then I go, and before I work out, I take Circ O2, get my nitric oxide up, and then afterwards, I use the Perfect Aminos. That's a typical workout for me, short version. I hope you enjoyed it.